और उसके बाद और एक है,
कोई नहीं, करवा देंगे।
3 दिन है।
लास्ट डिस्कशन एमबीबीएस
के अंदर है
डिजीज हो
ये लास्ट वाला
रिएक्शन।
ये ना ये आज का डेट है, ये देखिए ये क्या 20
डेट वाइज है।
हाँ डेट वाइज,
लेकिन 9 को है, फिर 11 को है,
11 का 2 है, देखिए
11 का 2 हो गया और फिर 23 को। चलो ठीक है, करा देंगे। ऑपरेशन पिक्चर ज़्यादा होती है ना शायद, पैथोलॉजी से लाइन में ज़्यादा, इस वजह से थोड़ा वो बढ़ता है।
और हम पेन ड्राइव से खुल रहे हैं ना, इसको डेट कब में लेके आना चाहिए था?
नहीं ऐसा कुछ नहीं है।
हाँ
अच्छा चलो उससे कर लूँगा।
हाँ,
हो गया।
अगर हम कॉपी करेंगे
मैं
तो बाद में डिलीट कर
मेरा रखता नहीं ना, इसलिए मैंने कहा
वो तो मैं डिलीट कर दूँगा डायरेक्ट में, इससे मुश्किल होता है।
चलो मुझे बच्चों ने लॉगिन कर दिया या नहीं, स्टार्ट हो ये मैंने लॉगिन कर दिया, बच्चों ने शुरू हो। ठीक
कहना पड़ेगा ना,
नहीं
अच्छा
ये सी है आप ना बस खत्म हो गया ना, पेन ड्राइव खींच लेना और कुछ 6 महीने।
ठीक। और साउंड
और सब इसमें क्वेश्चन जो लास्ट में क्वेश्चन पूछे उसके लिए ईमेल आईडी दे देना अपना लास्ट में।
ठीक है,
आप जाएंगे तो मैं बोल देना,
ये निकल देता हूँ, आप चले जाएंगे तो ठीक है। Good morning everyone. Today's class is bone reaction to injury. Today we will be learning about normal bone and reaction to bone injury. Now these are the questions you may be asked during exam, or there may be multiple choice question and short answer type of questions, and these questions may be asked during viva and also during case studies. So what are the types of bone? Bones are classified basically on the basis of location, shape and formation. According to formation, it could be membranous and enchondral bone. Membranous means the bone cells directly laid down mineralized osteoid on pre-existing fibrous connective tissue, and in enchondral ossification type of bone, at the both ends of the bone there are growth plates, and in the growth plates there are osteoprogenitor cells, mesenchymal stem cells that differentiate into cartilaginous tissue, and the cartilaginous tissue differentiate into woven bone and mature bone. So in this ossification the bone grows in longitudinal direction. According to location, we classified bones as axial bones and appendicular bones, or it could be atrial bones. Axial bones are skull, vertebra, ribs, and appendicular bones are basically bones of both upper and lower extremities. And as you know, ectal bones, they are basically the short bones which we see. Tarsal, metatarsal, carpal, metacarpal bone. And according to shape, it could be flat bone, tubular bone. Tubular bone could be long tubular bone, or short tubular bones, or it could be cuboid bones. So you should know also the parts of bone. When we talk about the parts of bone, usually we want to tell the parts of long bone. So long bones have ends, two ends, upper ends and lower ends, and at the ends there is covering of the cartilaginous tissue, and there is a portion of the bone, and after that at the both ends there will be presence of growth plates which over time fuses, and after the growth plate what we see the metaphysis and then diaphysis. Sometimes people may ask you, what is metaphysis? Now you know the metaphysis is the portion which is just after the growth plate, but it is above the diaphysis. So the growth plate, that portion is near the growth plate, the portion is called epiphysis. So it is basically epiphyseal portion of the diaphysis. So when we talk about the growth plate, we usually tell epiphyseal growth plate. I mean the location is just near the ends of the bone. So diaphysis has also cortex, I mean the bone has also cortex and medulla. The cortex is formed by compact hard bone and medulla is formed by trabecular bone. The trabeculae, ponytrabeculae are usually thin and they form a kind of mesoid, and that portion is also known as spongy bone. Now the composition of the bone, this is important for health of the bone, and this is also important for repair process or healing process, or if there is some sort of injury. Following injury, how fast the injury gets repaired. In bone, there are cells and matrix. The matrix is basically organic and inorganic matrix. Inorganic matrix are different kind of minerals, calcium, phosphorus, sodium, potassium, magnesium, and organic matrix are collagen, mucopolysaccharides, non-collagenous proteins, various non-collagenous proteins, bone-forming proteins, growth factors. In bone, there are different type of cells. These cells are derived from osteoprogenitor cells and also from hematopoietic stem cells. Osteoprogenitor cells are mesenchymal stem cells. The mesenchymal stem cells differentiate into osteoblast, and the osteoblast are incorporated within the matrix and form osteocytes. And there is presence of osteoclasts. The osteoclasts are derived from hematopoietic stem cells. Hematopoietic stem cells give rise to monocyte macrophage system. With influence of various factors from osteoblast and merostromal cells, these cells differentiate into pro-osteoclast or pre-osteoclast, and that differentiate and mature into osteoblast. So in the bone, the majority of inorganic components is comprised of calcium, which accounts for 99% of total body calcium, and about 4% of potassium is stored in the bone, 35% of sodium, 50% of magnesium, and 80% of carbonate, and 88% of phosphate. These are present within the bone. So bone is the storage house of so many different type of organic, inorganic components. In bone, there are about 1 to 2 kilograms of calcium and about 1 kg of phosphate. So organic elements, you know, these are cells and proteins. The cells, as I have mentioned, osteoprogenitor cells, they are derived from the mesenchymal stem cells. These cells differentiate into osteoblasts and osteocytes, and osteoclasts are derived from hematopoietic stem cells. Now proteins are basically type 1 collagen, which is deposited by osteoblast, and there are other proteins which are also produced by the cells. They are like calcium binding protein, osteonectin, sialoprotein, bone sialoprotein, mineralizing proteins such as osteocalcin, various enzymes, collagenase, alkaline phosphatase, and there are cytokines like prostaglandins, interleukin 1, interleukin 6, Rankel. Rankel is produced by merostromal cells as well as osteoblast. And prostaglandins, interleukin 1, interleukin 6, these are produced by different type of cells as well as cartilaginous cells as well as inflammatory cells. And various growth factors are also present. These are like insulin-like growth factor 1, platelet-derived growth factor, transforming growth factor beta. So these things are important for fracture, repair and healing. Now you can see here there is the pinkish material which is basically mineralized osteoid, and there are cells, plant cells with large nuclei, these are osteoblasts. And you can see here this portion of tissue is different from the other portion of the tissue. In this portion you see some bluish appearance of the tissue that indicates there is mineral deposition, that is calcium hydroxyapatite deposition. Okay? And in this area there is pale bluish area. This pale bluish area is indicating the presence of non-mineralized osteoid which is produced by these osteoblast cells. Now if you see this, there is some sort of peculiarity. The osteoblast, they deposit connective tissue, osteoid matrix, on the surface of the bone. So it is in unidirectional deposition of the osteoid. And if you see, if it is unidirectional deposition, how can this osteoblast be incorporated within the matrix? You can see there are layering of the osteoblast. This is a osteoblast which is producing osteoid matrix here. There is another osteoblast which is also producing osteoid matrix just over the another osteoblast. So this matrix, when this osteoblast will produce more matrix, this osteoblast will get incorporated within the matrix and it will become osteocytes. And there is another type of cells which is little bit different from this type of cells. It has got little more rounded, polygonal, and the nucleus is different. You can see the cytoplasm which is more pink. This cell is basically derived from mononuclear cells. So there is interaction between this osteoblast and these cells, and this cell differentiate into osteoclast over time. Now the osteocytes, they are basically incorporated within the matrix and they present within the lacunae, and these osteocytes intercommunicate with each other as well as on the surface of the cells which are osteoblast. With the help of cytoplasmic process, these processes are present in the canaliculus system. So the osteocytes are within the matrix of the bone and osteoblasts are on the surface of the bone. And if you see the osteoclast, their primary function is to remove the bone. So they are also present on the surface of the bone, and they are multinucleated cells. They are formed by the fusion of monocyte macrophages, cells of monocyte macrophage system. So these cells are osteocytes, and there are cells. You can see this cell and another cell. These cells are resorbing the bone. So these are osteoclastic cells. They are also present on the surface, and this cell form some sort of space we call is house shape canal. Yes. And there are the cells which are also present on the surface, and they produce osteoid. So these are osteoblastic cells. Now, what are the functions of bone? Bone provides structural integrity as well as strength to the body, and it protects vital organs such as brain, heart, lungs from different kind of injuries. And it is the storage house of different minerals, primarily calcium, phosphate, magnesium and sodium. And bone provides size and shape to the body. It is the largest organ of the body, largest organ system of the body. It consumes about 15% or 10% of the cardiac output, and it accounts for 15% of total body weight. It helps in movement with the help of tendon and actions of the muscle, and bone is the site for blood production, and the bone, the marrow which is present within the bone, which is responsible for production of the various blood cells, we call them red marrow. And it is also the marrow we usually divide into two types, red marrow and yellow marrow. Yellow marrow is also known as fatty marrow. So in fatty marrow there is triglyceride that acts as energy store. So it is the energy store. Bone represents also the energy store of body. There are certain organs where we see more metastatic tumors than the primary tumors. These are basically the liver, the lung, the bone and lymph nodes. So bone is one of the organ where we see more metastatic tumors than the primary tumors, and it is a very dynamic organ. There is continuous renewal and remodel. So what is this? That is also known as remodeling. What is this remodel? Remodel is nothing but resorption of the bone which is abnormal or defective, followed by formation of the new bone. So resorption is carried out by osteoclastic cell, and new bone is laid down by osteoblastic cells. And there are different cells which are involved in these systems, and different transcription factors, cytokines, growth factors, they are also involved in remodeling process. In the remodeling process, you will see participation of osteoblast and osteoclast, but they participate not individually, but they participate in large number. We call it as unit. So when these groups of osteoblast and osteoclast participate during a remodeling process, we call this basic multicellular unit, and this is required for growing of the bone, enlargement of the bone, as well as repair of the bone. So there are factors which influence this remodeling. These factors are systemic factors and local factors. We will discuss later. So remodeling occurs both in trabecular bone and in cortical bone, but trabecular bone has wide surface. So remodeling is more in trabecular bone compared to cortical bone. The surface area of trabecular bone is much larger than the cortical bone. There are several hormones growth factors and cytokines which are required and which influence this remodeling process, and these are basically parathyroid hormone, estrogen, testosterone, glucocorticoids, and vitamin D, interleukin 1, interleukin 6, their cytokines, and different kind of growth factors as I mentioned earlier. So mesenchymal, during the repair process, there is transformation of mesenchymal progenitor cells into osteochondroprogenitor cells. Now these osteochondroprogenitor cells, as the name suggests, it can differentiate into osteoblast or chondrocyte, and that depends upon the pathways which are activated during the process, pathways as well as some genes which are active during this transformation process. When there is activation of Wnt beta-catenin pathway and the RUNX2 gene is active, this osteochondroprogenitor cell differentiate into osteoblast. And you must know, when this some pathway is active and gene is active in one cell, other genes and pathways usually they remain silent. So these cells will differentiate into osteoblast when Wnt beta-catenin pathway is active and RUNX2 gene is also functional. Similarly, when the SOX9 gene is active and transforming growth factor BMP pathway, bone morphogenic protein BMP, this pathway is active, then this cell will differentiate into chondrocyte. Now this osteoblast differentiate into osteocytes. So what are the fates of the cells? You know, whenever some reaction is going on, it cannot continue for long time, because for any reaction, whether it is inflammatory reaction or some other process, it requires huge amount of energy, consume huge amount of energy of our body. So when the function is over, then there will be the reaction will subside with the help of different kind of activation of other factors, other growth other modulatory factors that terminates the reaction process. So mesenchymal stem cells, with when the beta-catenin pathway is active, the cells will transform into osteochondroprogenitor cells, and it can differentiate into pre-osteoblast, immature osteoblast, and then mature osteoblast. Now this mature osteoblast can transform into osteocytes when it is incorporated within the matrix, or it may remain as silent cell, inactive cells, which is present on the surface of the bone as flat cells, okay, or the cells can undergo apoptotic necrosis. When SOX9 gene is active, this cell can transform into chondrocyte. Now, what are the different size kind of bone reaction in different conditions? So bone reaction can be seen in different conditions like infection, neoplastic condition, and for you never forget the fracture following trauma. Okay. So neoplastic condition, what we see the periosteal reaction in osteomyelitis, chronic osteomyelitis. You will see there will be periosteal lifting and there is periosteal reaction. In neoplastic condition also we get reactive bone reaction, periosteal reaction, because in this condition also there is periosteal lifting like osteosarcoma and AIIMS sarcoma. These are fast growing tumor. So when the tumor grows, there will be lifting of the periosteum, and and when the periosteal lifting is there, there is injury to the periosteum and periosteum shows reactive process, there will be new bone formation. Okay. Of course, we will discuss about the trauma, and there are secondary disorders. In metabolic disorder, we see various kind of reactions, especially in endocrine disorders. In renal osteodystrophy, there are several kind of endocrinal dysfunction, disorder, and we see different kind of reaction in the bone. In metastatic disease also, there is interaction with the osteoblast and metastatic cancer cell, and we see the reaction bone. So infective process, basically pyogenic bacterial infection, we call pyogenic bacterial osteomyelitis or bacterial osteomyelitis, but other osteomyelitis like leprosis, syphilis, tuberculosis, salmonella osteomyelitis, which is seen in sickle cell disease, which is common, sickle cell disease, and opportunistic infection, there also we see different kind of reaction. And as I have said, in metabolic bone disease, especially hyperparathyroidism and renal osteodystrophy. In renal osteodystrophy also, we also see different kind of problems like secondary hyperparathyroidism, vitamin D deficiency. So we see a bone reaction. Now, what is fracture? The fracture is a break due to undue pressure. So in fracture, the bone gets broken, and sometimes the broken bone may puncture the skin. We call it compound fracture. Someone may ask you different kind of fracture, types of fracture, and some of the types you should know. Okay. So what are the etiology for fracture? Basically, these are due to stress or due to blow, like road traffic accident, direct blow, repetitive forces can also cause stress fracture that happens in during Mars. Okay, and usually in the bones of foot bones, ankle, tibia, and also we can see in hip stress fracture. In stress fracture, there is hairline crack, and this fracture can heal quickly if we maintain the stability, because there is no displacement of the ends of the fracture. So healing process is rapid in this condition. So what are the risk factors? Risk factors are like overuse, then poor muscular balance, lack of flexibility, weakness of the soft tissue, various biochemical problems, malnutrition. These are all risk factors. In malnutrition, suppose in malnutrition there will be weakening of bone. Suppose there is bone, there is vitamin D deficiency. What happens? There will be osteoid formation, which is non-mineralized, unmineralized osteoid. So this bone remains weak. So if there is some sort of trauma, the bone gets fractured. Similarly, in osteoporosis is a condition where the total bone is reduced, but mineralization is normal. So when the total bone is reduced, you can imagine the bonitobaculi, the cortical bone, they are also reduced. So they are weak. So minor trauma can produce fracture in this condition. Signs and symptoms, basically pain, tenderness, and if there is some major trauma, there will be ulceration, hemorrhage, swelling, and different. So these are the different type of fracture, and you should know, because if you know, then you can imagine what type of healing, bone healing is going on in the body. Okay. So this fracture can be simple fracture like oblique fracture, or comminuted fracture and open fracture. Now, if you see among this fracture, the open fracture, which is also known as compound fracture, this fracture is very bad fracture because it communicates with the external environment. So this fracture is likely during healing process, or this site is likely to get contaminated, by various microorganisms, bacteria. So osteomyelitis or infection, chronic infection can occur in this condition. So healing process will be delayed in this condition. Okay. Now there is comminuted fracture. Comminuted fracture. Here you can see there are multiple bone fragments. So during what happens in this fracture and also in compound fracture during reduction, there is likelihood that the some tissue, soft tissue will be incorporated in between the fracture end. I mean in between the ends of the bone. So naturally the healing will be delayed. We will discuss also later about this thing when we will discuss about the different types of fracture healing. Now the fracture can also occur in the epiphyseal cartilage or epiphyseal growth plate. Okay, and there are different kind of fracture you will learn during your orthopedic, but some of the things you should know. The epiphyseal growth plate may be completely dislodged, and it could be also total epiphyseal growth plate and portion of the metaphysis could be also displaced, and some portion you can see the complete break in the portion of the cartilage, epiphyseal cartilage, and there is a growth plate. This portion is growth plate, this portion is growth plate. So portion of the growth plate and the cartilage is completely separated from the metaphysis. Here in type 4 type of fracture, what you are saying, along with this there is a portion of the metaphysis, and here because of compression the portion of growth plate is compressed. Okay. So these fractures are basically corrected without exploration. Okay. So what kind of tissue injury occurs in fracture? As you know, when there is fracture, of course the bone will be injured, the marrow will be also injured, there will be injury to the periosteum, and blood vessel will be disrupted. Following disruption there will be hemorrhage, muscle can be injured in muscle, tendon and nerves. This could be injured in major trauma. So fracture repair is a complex process, and this leads to regeneration and functional restoration of the bone, and the mechanism depends on the position of the fracture and the stability of the fracture. Okay. So what are the types of fracture healing? We classify it into two types: primary healing, also known as direct healing, or secondary healing, which is also known as indirect healing. In primary bone healing, when the fracture is ends are restored with optimum compression, and the repairs occur internally without any callus formation. Suppose in surgical repair, I mean after dissection, the ends are aligned properly with optimum compression. What happens? The osteoblast in this location directly laid down the mineralized osteoid. So there is direct healing. This is known as primary healing or direct healing of the bone. So here the bone is directly getting repaired without other changes. Direct there is bone formation, healing. During exam, people will ask you about the secondary healing or indirect healing, the stages of the healing. When the people will ask you about the stages of the healing, that indicates it is secondary healing or indirect healing, because in primary healing there are no stages. There is direct deposition of mineralized osteoid and direct communication, I mean this thing, fusion, okay, of end to end of the bones. So when the anatomic reduction, apposition of the fractured ends are not achieved optimally and the optimum compression is not possible because of kind of fracture or because of other problems like soft tissue incorporation, there is formation of soft callus as well as bony callus formation, and subsequently there will be, with the help of remodeling, there will be bridging of the gap and there will be total complete restoration of bone anatomy as well as function of the bone. So what are the stages of secondary healing? This is important because this question is asked often in the exam, and also you can get questions, SAQ or MCQ also, this question from secondary healing. So in the first stage, which is known as inflammatory phase or hematoma phase. So there are 4 stages: inflammatory phase or hematoma formation, then soft callus formation. This is basically granulation tissue, which you also see in other conditions like healing of other areas, whether it is soft tissue, skin, in ulcer healing, there is also granulation tissue formation. Hard callus formation, this is unique because this will occur in secondary healing of the bone fracture. Okay, and remodeling. The purpose of the remodeling is to provide proper shape of the bone as well as strength of the bone. Okay. So in the inflammatory phase, what happens? There will be, following the fracture, when the major trauma is there, there will be disruption of the blood vessel and there will be injury to the soft tissue. So following disruption, what happens? There will be hematoma or hemorrhage in the area, hematoma formation, and because of injury to the various tissues, there will be release of different kind of cytokines, inflammatory cytokines like interleukin 1, interleukin 6, tumor necrosis factor alpha, and there will be also release of the growth factors which are present within the cells. Okay, different type of growth factors, insulin-like growth factors, okay, platelet-like growth factors, and different kind of growth factors. Okay. There will be release, okay, and also there will be injury to the periosteum. So whenever there is injury to the periosteum, there will be invariably reaction, periosteal reaction. Periosteum has 2 layers. The inner layer, which is present over the bone surface, we call this cambium layer, and the outer layer, which is attached to the fascia, tendon or muscle, that layer is called as fibrous layer. So beneath the cambium layer, there is presence of osteoblast or osteoblast, which could be in dormant stage or inactive stage. So following injury, this osteoblast become very active and they show their activation. So in this phase, inflammatory phase or hematoma formation phase, there will be activation of cellular signaling mechanism. Okay, and this activation will also lead to chemotaxis of different kind of inflammatory cells. Okay, because of release of different type of inflammatory cytokines and growth factors, also chemotactic factors which are released by the inflammatory cells. So more inflammatory cells will be attracted in this area and they will attracted in this area. Okay. So in the initial stage of fracture healing, what will happen? There will be injury to the bone, there will be injury to the soft tissue, marrow tissue, periosteal tissue, there will be following injury of the blood vessel, there will be hematoma formation, hemorrhage and hematoma formation, that will also lift the periosteum, so there will be periosteal reaction. Okay. So in this case, along with the hematoma formation, there will be recruitment of inflammatory cells. What are inflammatory cells? They are basically polymorphs and macrophages, monocytic cells and polymorphs. Okay. So in the initial phase there is hemorrhage and there is injury, soft tissue injury as well as bone and other tissue injury. So following that, what happens? There will be formation of soft callus, that is also known as granulation tissue formation. This occurs within 1 week or within 7 days of the injury. So in this process, what happens? There will be regrowth of the vascular blood vessels. There will be new vascularization of the area, and also there will be proliferation of fibroblastic cells, myofibroblastic cells. So there will be vascularized connective tissue which will be occurring in this fracture site. We call it granulation tissue. Okay. So in the granulation tissue, what are the components you are likely to see? You will see proliferating capillaries, you will see proliferating fibroblasts. Along with this, you will see inflammatory cells. What are these inflammatory cells? There will be neutrophils, macrophages, lymphocytes, because these cells will be recruited here for the repair process. Okay. They will release different kind of cytokines and also other factors to stimulate the repair process. So these callus, it is soft callus. This callus is known as soft callus, and it usually last for 2 weeks. So after 2 weeks of the fracture, what happens? There is formation of the hard callus formation. Okay. So as the name suggests, hard callus, what does it indicate? It indicates there is formation of the hard tissue. What are these hard tissue? They are basically cartilage and bone. These are the hard tissue of our body. There are soft tissue, there are firm tissue, and we call it also hard tissue. Okay. So which one is soft tissue? If somebody tells you what is the example of the soft tissue, if you touch the ear, these lobes, this portion, you feel it is soft. And what is the example of the firm tissue? This portion is usually firm tissue. And if somebody asks you, show me where you can get hard tissue, so you can get here, this is hard tissue. These are examples. Okay. So in hard callus formation, what will happen? There is formation of new bone. So new bone is also known as oven bone, and there is also formation of cartilage. Okay. Cartilage is formed because the mesenchymal or osteoprogenitor cells, mesenchymal stem cell, they differentiate into cartilaginous tissue, chondrocytic cell. So there will be formation of new bone, which is mineralized bone, and this stage, usually the hard callus stage, usually last for 4 to 16 weeks. Okay, 4 to 16 weeks. That means it is about 1 month to 4 months hard callus formation. Okay, so after this this is, you can see, this is the fracture, and you see after reduction there is repair. So this is hard callus formation. Okay, because of the repair hard callus formation, you can see the tissue here. Okay. Usually the soft tissue, if you do plain radiography, the soft tissue and cartilaginous tissue cannot be detected by plain radiography. They are radiolucent. Okay. So as you are seeing the tissue over here, that indicates here also, that indicates there is formation of mineralized tissue. So mineralized osteoid is present here. Okay. Cartilaginous tissue and soft tissues are radiolucent. They cannot be picked up by plain radiography such as X-ray and CT scan, but they could be detected by MRI, magnetic resonance imaging. Okay. So after 4 months, there will be remodeling process. In the remodeling process, what happens? There will be participation of basic multicellular units. What are these basic multicellular units? There are groups of osteoblasts and osteoclasts. They participate in remodeling process. What is the aim? The aim is to provide the proper shape or reshape of the bone, as well as to strengthen the bone. The hard callus, the initial callus is formed by cartilaginous tissue and new bone. The new bone is basically oven bone formation. I'll tell oven bone later. So in oven bone, what happens? On the surface there will be active osteoblast, and in the matrix we see the osteocytes which are not matured properly. They are immature osteocytes. Okay. In oven bone, what happens? The number of the osteocytes, they are more compared to the mature bone, which is also known as lamellar bone, and the collagen in oven bone is deposited in disorganized haphazard pattern. So you see the collagen in disorganized pattern, and lamellar bone or in mature bone, the collagen is in collagen fibers are present in parallel pattern, parallel to the surface of the bone, okay, or parallel to the surface of the trabeculae, bony trabeculae, okay. So this portion is cartilaginous tissue. So in suppose in the fracture of shaft of femur, so in this area there should not be any cartilaginous tissue, because if this tissue is there, this portion will remain weak. So this tissue has to be removed, and this tissue has to be replaced by mature bone. Okay. So for this purpose there will be remodeling process just to get the restoration of normal bone and normal function. So if we revise this, what are the stages of the fracture? The initial stage is the hematoma formation. Okay. Following that, there will be hematoma formation as well as inflammatory stage. Okay. So this is inflammatory stage with hematoma formation and inflammatory stage. Following this, there will be formation of the granulation tissue. Then there will be soft callus formation. In the soft callus formation, there will be cartilaginous tissue as well as oven bone. So inflammatory stage, this stage lasts for 1 to 2 days, and the granulation tissue starts from the 3rd day or 2nd or 3rd day. Okay. So this stage usually we say up to the 2nd week. So from 2nd week we see the hard callus formation. 1st week to 2nd week, the hard callus formation. Now this hard callus will remain for their several weeks, about 4 months, and after that there is remodeling process. Okay. So in this remodeling process, what will happen? There will be activity, and also in the formation of the hard callus and remodeling process, there will be activity of both osteoblast and osteoclast. So osteoblasts are activated if there is Wnt beta catenin pathway, activation of Wnt beta catenin pathway. So there are certain proteins, we call it Wnt proteins, they bind with the LRP5 and 6. These are the receptor, LRP5 and 6, these are the receptors present on the cells. Okay. Then there will be activation of translocation of beta catenin from the cytoplasm to the nucleus. Beta catenin is normally present within the cytoplasm. When it translocates into the nucleus, there will be activation of there will be proliferation and differentiation of osteoblast. Okay. So what is the function of the osteoblast? So osteoblast will produce osteoid matrix, which is basically type 1 collagen and different kind of bone forming proteins, alkaline phosphatase. Okay, and this osteoid formation is present in unidirectional pattern. They also mineralize the connective tissue. These cells regulate the differentiation and activity of the osteoclast. Indirectly, they maintain the calcium homeostasis and also homeostasis of other minerals. Okay. These cells form osteocytes, or they may remain as dormant cells on the surface of the bone. Okay. So osteocytes are present within the matrix. They intercommunicate with each other as well as on the surface of the bone cells, which are osteoblast. Okay. So they can also sense the stress of the bone. That's why they are known as mechanotransduction, and they also modulate the activity of the bone. So osteoclast, these are present on the bone surface, and they resorb bone for the purpose of remodeling. When the bone is resorbed, there will be also formation of new bone. Now how the osteoclasts are activated? Okay. Now osteoclast or pre-osteoclast, they have receptor. We call it RANK receptor. This is basically receptor activated of NF kappa beta, okay, receptor. Now RANK ligand is produced by osteoblast or merostromal cells. Now this RANK ligand bind to the RANK receptor, and there will be activation and differentiation of the cells, and that will form osteoclast. So this requires for the formation and differentiation as well as maturation of mature osteoclast. Okay. Now the osteoblast also produce another factor that is known as soluble factors. This is known as osteoprotein, OPG. Okay. This osteoprotein can bind to the RANK ligand. The RANK ligand is produced by this osteoblast or merostromal cells. Now this factor bind to this ligand, so this RANK receptor, which is present on the osteoclast, cannot bind with the ligand. So that's why it is known as decoy receptor. Okay, because there will be no functional activation of osteoclast. Okay. So what happens? During the function of the osteoclast, there will be release of different growth factor, different proteins, which in turn help in osteoblast to activate and deposit new bone. Okay. So this happens. So there are factors which help either activate or inhibit osteoblast. You must remember the parathyroid hormone, usually it activates the osteoclast, so there will be more bone resorption, but intermittent parathyroid hormone stimulation also stimulates the osteoblast. That's why there will be more bone formation. So in osteoporosis, if you give intermittent parathyroid hormone, that will increase the bone formation. Okay. So when beta catenin activation is important for the osteoblast formation and function. And important hormones and vitamins like parathyroid hormone, vitamin D, estrogen, okay, various growth factors, matrix proteins, these are important for the remodeling process. This is oven bone, I told you. This oven bone, it has got disorganized matrix as well as osteocytes. They are, you see, they are more in number Their number is more compared to the lamellar bone, which I will show later. And they are present haphazardly. This is the surface. You see, they are not present in parallel direction. And this is mesenteric stain. You can see the fibers, the collagen, type 1 collagen, they are also present in different direction. This is lamellar bone. Now you see these are osteocytes. They are also in parallel with the collagen fibers. Okay. So this is lamellar bone. This lamellar bone is stronger than the open bone. So there are hormones, different hormones which regulates this remodeling process. You know the parathyroid hormone. Parathyroid hormone stimulates the osteoclast to resorb bone. Calcitonin. The osteoclast has also receptor for calcitonin. When the calcitonin binds to the receptor on the osteoclast, it inhibits the function of the osteoclast. What osteoclast does? Osteoclast resorb bone. So during resorption, what will happen? The mineral, what is the most predominant mineral in the bone? Calcium. So calcium will be released. Okay. So when calcitonin binds to the receptor, calcitonin receptor of the osteoclast, there will be no calcium release. So indirectly, this also maintains the serum calcium level. Okay. So insulin stimulates the osteoblast. Thyroid hormone, you know, this is also required. Thyroid hormone is very important for the normal growth of the growth and development of skeleton. Estrogen, it also helps, but androgen, it inhibits the cells, bone cells, the osteoblast. Okay. Glucocorticoids, you know, if you give the glucocorticoids for a long time, it will leads to osteoporosis. It inhibits the collagen synthesis. Vitamin D is required for bone formation and mineralization. In absence of vitamin, that happens in osteomalacia. Rickets, bone is weak. Okay, the bone is not mineralized. So we see osseous seams which are unmineralized. Okay, never confuse this type of fracture healing with the type of ossification. Okay, so that's why remember this type of ossification is basically there are two types. Membranous ossification, the connective tissue is directly is laid down by mineralized osteoid. Okay, so there is direct bone formation. This kind of bone formation, this kind of tissue deposition occurs in primary healing of the bone. In enchondral ossification, in the growth plate, there are osteoprogenitor cells. So cells will differentiate in cartilage, and there will be formation of new bone or open bone. This is the metaphyseal. This is the growth plate. If it is the end of the bone, so this is known as enchondral ossification. Okay. So enchondral ossification, there are cells which participate, both osteocytes and cartilaginous cells. Okay. Now we have talked about various kind of injuries, but we didn't talk about the implant injury. You know, the implant is implantation or artificial prosthetic implantation is very common nowadays, to restore the function of the body or bone. Okay, so implant is associated with high risk of infection, loosening of the bone, reaction to the implant material, and osteolysis. Implants are basically foreign substances. So whenever any foreign substances are there in the body, what happens? The body will show some sort of reaction. So what happens? There will be recruitment of inflammatory cells like macrophages. So whenever the macrophage is recruited, they will produce inflammatory cytokines. So inflammatory cytokines will stimulate cells to differentiate into osteoclast, and the osteoclast will resorb the bone. So implant also can't produce bone injury. Okay. So what are the factors influencing the fracture healing? So these are very important. These are host factors or environmental factors. You have to remember. Okay. So in young, the fracture healing is rapid compared to old age. Okay. So age of the patient, if there are comorbidities like diabetes, tuberculosis, some medications which inhibit, some sort of inflammation like NSAIDs, corticosteroid use, smoking, nutritional factors. If the nutrition is poor, the healing is poor, whether it is healing in the soft tissue or whether healing of fracture. Okay, degree of the trauma, the tissue incorporated within the interposed end, type of fracture, whether it is comminuted fracture, whether it is compound fracture. Okay, if there is major loss, severe trauma, severe soft tissue trauma, severe tissue destruction. Okay, these are important. Systemic factors and various systemic and local factors. Suppose there is ulceration, major ulceration over the injury. If the injury is very contaminated, okay, so healing will be delayed. So complication, the complications are basically immediate complication or delayed, okay, or late complication. So immediate complications are if there is severe hemorrhage, so there will be shock, myoclonus, septicemia, infection, disruption of the marrow that may lead to fat embolism. Okay, if there are multiple fracture, okay, and this fat embolism can also occur during surgery if there is during the reduction of major trauma. The late complication, which you can call also complication of the fracture healing. This is malunion or non-union. Okay, malunion means it is not united properly. In there, the alignment is not proper, the direction is not proper. Okay, the remodeling, during remodeling, the bone remain in different position. Okay, in non-union, what happens if there is lot of connective tissue in between the fracture end, or if the tissue is very much revitalized in the fractured area, what happens? There will be fibrous communication. So fibrous union will be there, and it forms like a kind of pseudo joint also. Okay, non-union, delayed union, chronic osteomyelitis and chronic pain. These are the complications. So what are the risk factors? If it is not risk factor for non-union, if the fracture is not stabilized properly, if the area is avascularized, if there is excessive motion, foreign body incorporation, suppose there is tumor in this area and it is a pathological fracture, okay, infection, so all these things are risk factor for non-union or also delayed union. Okay, thank you. If there are questions, because I can't hear here, if there are questions, please email to me. I have given email address. You have seen in the first this thing, email address, it is given over there, and I am also writing over here email. Note down my email. Okay, this is my email address, so you can send the question to my email address and I'll reply. Okay, there is no problem. And if there is possibility in any time, it is not that particular time or this thing, individually or groups, you can ask me question, or you can get my phone number also. Okay, it is already given. You can collect my phone number and directly you can ask me if there is any sort of question. Okay, thank you very much for your kind attention and listening. Sorry for the delay, we also started little bit late. Okay, thank you so much.
ये बहुत इम्पोर्टेंट है। थोड़ा ना क्लास ये हो गया। हो गया ना क्लास बड़ा हो जाता है। पूरा